Welcome to Medicine. I'm Dr. Othniel Doolittle, here today to talk about how you can enjoy documenting, like genuinely enjoy that part of your job. And I do that by looking at it as a game. If you're always sitting there assuming that there are these evil players, that every kind of kink and problem that comes into your ER, every time they throw something new at you with the EMR or with documentation requirements, if you believe that everyone's out to get you, you're just going to be frustrated all the time. You need to be able to look at it in a way like you just rolled the dice and you wanted a 5 and you got a 4. So your logic, your strategy just changes a little bit. And I look at it like it's a game. I'm just beating the game with the goal of being able to do something more fun afterwards. So I get through my documentation as quickly as possible. I have a few key things in mind so that I can get it done and be really happy with it, not be thinking about what I documented later, and I get to go home and rest. And more importantly, on shift, I get to sit back and relax. And a documentation is a small portion of what I do. And I have time to spend more time with patients and not let the machine come and block me from those patient encounters, as the system is designed to come in and separate you from that personal relationship with the patient. And in the ER, you need to have that time to sit down, look into the patient's eyes, and figure out what is really bothering them, what is making them tick. How can you help them? So let's run through a couple things. How can you do this? How can you really enjoy your work? So you have to remember that documentation hits a few key components for you. It's a legal document, it's a communication document, and it's for coding and billing. So you need to build it legally, defensibly, and accurately. And it needs to be clear and concise and provide enough history and physical exam, because you're providing a handoff note to your colleagues. Additionally, there are a few fun things that you get to put into the note where you beat the game and you throw in some coding and billing jargon, and you're documenting some extra things. For all of these components, you're kind of throwing in a little bit of extra, more than we used to do with the paper T sheets where you could just jot down a note and it was straightforward. Your note needs to be really accurate. And that's because if you walk in and you throw in a template and then a YouTube video shows up, or the security camera that you've never actually gone in the room and you didn't actually do that exam, the patients are frustrated, they don't trust you as much, and it's just not very defensible. You also have to document defensibly, thinking about this could be in court. So you're just documenting clearly and your thought process, and you're leaving out the things that wouldn't make sense to a jury of your non-peers. Things like a 16-year-old that says, yeah, I get chest pain every time my friend punches me in the chest. You don't include chest pain in review systems. It's not accurate to say that he has chest pain on an occasional basis. It's just complicating the picture. So you're narrowing down your focus a little bit. AI scribes are not going to be able to do that very well for you. You need your doctor brain in order to make those really good decisions. You're also creating a handoff note. So as I'm in the room, exiting the room and putting in orders, I'm thinking about how I would give this patient's story to a colleague. That might be the specialist that you're about to call, the transfer center as you're trying to get the patient out of there, if you have the ambulance rigs available, or the hospitalist you're admitting to. Maybe it's the PCP that's going to be reading your note and wanting to know what happened in the ER and what was your thought process. So my HPI clearly tells a story, what brought that patient in, and that's fun. We love human stories and that connection. And if you're able to tell that story well and accurately, you're lifting that patient up and bringing life to them through that. You have a clear physical exam that I focus on the things that are going to be important for later. So if there's a wound, then I want the primary care provider or the a specialist to know exactly what I was seeing at the time in lieu of pictures, because we don't always have the ability to put those into the EMR, or a neuro exam. Want it to be really crystal clear so that the hospitalist knows that if anything changes overnight, they can look at my exam and they know what happened in the ER. And I can update this with notes at any point in time. The last component is you're wanting to beat big corp, whether it's CMS or payers who are constantly changing the game, whether it's urosepsis, which was a nice, clear, straightforward diagnosis of something that's real. And they're like, oh, we're not going to cover that anymore. You need to describe it differently. The rules just changed a little bit, and we get to use our smart brains to get in there and be like, oh, yeah, this isn't a patient that's wheezing and needing a little bit of oxygen. They have acute hypoxic respiratory failure. And it's just fun to think of those things and get those in the note so that you're winning, you're bringing that money to the hospital and back to the table and keeping them from hiding it. All of this comes together in just you're building that structure in your head, able to sit down after orders and get that note out in 2 minutes. You want to be done with the bulk of the note and be able to just throw in some updates as you do different things, put in a timestamp note when you go and talk to the patient about their discharge plan, and be done. When the patient is being handed their discharge paperwork, you're done with the documentation and you're not worried about it for later. You're able to sit back, go spend more time with other patients, talk with your nurses. You're not having a burden on you from this. So whether you look at it as kind of a game to beat the system or just a way to go faster, have a game where you're being more efficient so you can do the things that you really want to do, which is spend time with patients or maybe get to your TV show. You want to be able to enjoy your work. And by looking at your notes as things that you can get done quickly, things that you only need a few elements in, you can have a lot of fun on your shift. It is really important to have joy in medicine and enjoy your work, enjoy your shifts. Don't let the big EMRs or any big system get between you and doing what you love, which is enjoying taking care of people and changing lives. If you have other ideas about how to make your documentation better, faster, and really enjoy medicine, feel free to reach out. I'm Dr. Othniel Doolittle with Welcome to Medicine. If this was good for you, please like and subscribe or send me some comments. Thank you.